Good morning. My name is Dr. Kacie Culotta. I am the owner of Latched Beginnings, and I'm a dentist that specializes in treating infants for oral ties. I'm also trained as a lactation counselor and a myofunctional mastermind. One of the questions I get so often is about pacifier use. And I always tell families that it's okay to use a pacifier. Families are often ones that hide their pacifier use from their dentist, and I get it. The world will make you feel guilty or unsure about using one. But as a mom and a dentist myself, I really want to change that narrative and give families the information they need so that when they're using a pacifier, they're using it correctly. Pacifiers can be amazing tools when we use them correctly. And the problem is that if you use the wrong pacifier or you're using it for too long, that's when we have lasting impacts to the baby's growth. So let's dive in and let's talk about just that. First of all, just get to the simple stuff. What is our goal for pacifiers? And the key point is that we're going to use that pacifier as a secondary comfort tool to help calm and soothe your newborn, especially in those early weeks. But we want a pacifier that promotes really good oral motor coordination. So we want a pacifier that helps that infant learn how to use their tongue and their lips and their cheeks correctly. The goal is that we want to make sure that pacifier does not interrupt any natural movement patterns. But ultimately, the end point is that we want our infants to learn how to self-soothe with time. And the question I get is, does an infant have to use a pacifier? The answer is absolutely no. It is not necessary for life for an infant to use a pacifier. But again, as a mom, myself, I can find that it is very helpful in certain circumstances. The reason it's helpful to soothe an infant has all to do with the suckling reflex. And this reflex is really, really cool because the tongue and the lip start to form when the mom is 2 months in her pregnancy. And the suckling reflex really starts to appear around week 25 of pregnancy. It's really refined by that 34, 30-week point. And that's an important note, especially if our babies are born prematurely. So with the suckling reflex, it's going to be triggered when the infant activates their tongue to the palate, and that's really going to activate some important cranial nerves. And when that activation happens, the infant's going to get a rush of dopamine, serotonin, endorphins, all the really good feel-good hormones. And that's going to promote really good tongue movement. Now, pacifiers can be really beneficial, and there is fantastic research on just that. The research will show us that using a pacifier early in life, and when I mean early, I mean under 12 weeks, is going to help muscle strength, and it's also going to help decrease the percentage of SIDS in our newborns. It will increase the oxygen intake and actually soothe infants during medical procedures when they're using a pacifier. And again, for most infants and most families, it's going to be a great way to offer comfort to our children when we know they're not hungry and we know that they're full, but they need a little bit of soothing along the way. So important to note that, again, the benefits of using a pacifier are vast, and two, that they're really the strongest in those first 4 months of life. And again, that ties back to that suckling reflex that we just talked about, because that suckling reflex is really active until about 12 weeks when it starts to integrate into that baby. After that 4-month mark, around that 12 to 16 weeks where the suckling reflex has started to integrate, the pacifier is now a comfort tool. It is no longer a developmental tool. And that is going to be important for when we talk about how to wean a baby. When we overuse a pacifier after that reflex has integrated, this is when we start to become hesitant, and it will start to become a problem with hindering the airway, hindering oral function, and hindering just oral growth in general for that infant. So I always say timing is everything when we offer a pacifier. When we are talking about newborn, we want to always only offer a pacifier when we know the baby is not hungry. So when a baby is full is the right time to offer a pacifier. And this is important because we never want to offer a pacifier as an alternative to when that infant is actually hungry. And this is why we think and consider introducing a pacifier more around day 4 to day 10. And this is not based on any type of significant research based on the pacifier itself, but more that it takes the family a few days to learn the feeding cues for that specific infant. So once a family really understands the feeding cues of an infant, noting that that infant is not hungry, but just needs soothing, that's a good time to start introducing the pacifier. The other thing when we want to offer the pacifier is really to allow it for comfort cycling and for help with sleep. But we are not going to give this pacifier simply to the infant as a form of entertainment or throughout the entire day. And just like we've spoken about, we are not going to give this pacifier when the infant is actually hungry. The other thing to note is for our newborns that are in NICU, it will increase oxygenation for our infants and decrease pain during procedures when they use a pacifier. So premature babies given pacifiers in NICU, I am 100% for. It is shown that it will help them, gain weight, it will give them a soothing mechanism, and long term it's going to strengthen their feeding coordination. So a pacifier in NICU, absolutely a good thing to consider. Now, when a baby won't take a pacifier and the family wants that infant to, we can troubleshoot a few things. The one thing I tell families is that suckling on a pacifier is a different skill set than feeding at breast or feeding at bottle. So it's going to take a little bit of training and practice for that infant to learn how to do that. Some infants will have high gag reflexes. So when that pacifier touches their palate, they're going to gag. Now, this is because the palate is just not desensitized. One of the key reasons that might be the case is a potential tongue tie. So since that tongue has not been able to touch the palate throughout the pregnancy and the early weeks of life, that palate is just really sensitive. Anytime something touches it like a pacifier, that infant's going to gag and then they're going to not accept the pacifier. Another reason I see why babies won't take a pacifier is instead of them having a really coordinated suckling action, they're actually chomping instead. So instead of them using those tiny little tongue muscles, which is a fine motor skill, they are going to use the external, like chomping cheek and neck muscles to help hold and eat. This can be a sign of oral tension. This can also be a sign of an oral tie. And so that's something that we want to dive into if we see an infant chomping. And then another reason the infant might not take the pacifier is pacifier selection. When that infant won't take the pacifier and we've given the family time for them to learn how to use it, they've given the infant practice, then we want to dive into maybe what's the root cause of that reason. We already talked about the high palate and that being a sign of a possible tongue tie. Some infants have a lower muscle tone, so suckling on the pacifier takes a lot of muscle control and they need some support with that. The overactive gag reflex, oral ties, and body tension are all other reasons why babies might struggle with taking a pacifier when the family wants that to happen. So I know you're all here to know, like, okay, what's the pacifier we should give our infant? And I always tell patients and families that when we're considering the right pacifier to give our infant, we need to realize that marketing is very intense for baby products and that not all pacifiers are created equal. So when we are choosing a pacifier, I want families to always choose a pacifier that I call an act use pacifier. So one that the pacifier stays engaged in the infant's mouth when the infant is actively suckling. When the infant stops suckling, that pacifier should fall out. If the pacifier stays in passively by just kind of plugging into the palate and staying there, or it promotes a really shallow latch, these are designs that we absolutely do not want to choose for this infant. With an active use pacifier, this is only going to stay in the mouth of the infant when they're actively suckling. It should fall out when they're done. This will help mimic the natural latch and will help encourage a healthier feeding pattern. We definitely want a pacifier, and all pacifiers should be lightweight and it's supportive of their developing oral muscles. And some of those that are really great that are name brands would be the Ninico pacifier. I like this one because it's really thin. It's clear so you can see the infant suckling. This is a great tool, especially when you're utilizing it with suckling therapy, physical therapy, or occupational therapy. Our infants will usually take a little longer to get the right suckling pattern with this pacifier, but it is a fantastic one to use. The other pacifiers that I like that are really common to find would be the Avent Soothie pacifier or the Dr. Brown's pacifier. When you look at these pacifiers, you're going to see that they are longer and they're thinner, and that there is no bulb at the end. So they're thin the whole way through. And what that means is there's nothing for that infant to latch on into their palate. In order for that infant to have the pacifier stay in their mouth, they have to keep suckling it. So it's used, and then when they're done using it, it's out of the mouth. That's what we want. Now, for pacifiers that we want to avoid, we're going to want to avoid any of these pacifiers that I call passive use pacifiers. These are the ones that will just passively sit in the infant's mouth, even when they no longer are suckling on it. So those, I like to say, they plug into the palate and just stay there regardless of what the infant is doing. These designs will look like, they almost look like a lollipop. They have a bulb at the end. They are much bigger at the end of the pacifier than the beginning. And these will help really promote low tongue posture because, again, they're going to stay in the infant's mouth regardless of what that infant is doing. So the pacifier is in and the tongue is going to sit really low. That's really going to cause several encouragements of the tongue to have poor oral coordination, a tongue thrust, really shallow latching habits. And in the long term, we can start talking about its relevance to open bites, high palates, and misaligned teeth. Often these lollipop pop or bulb shaped pacifiers are incorrectly marketed as similar to breast or orthodontic pacifiers. So again, now we know that is a marketing term and not one that we're going to fall for. The other thing to note when you're talking about pacifiers is what we attach to a pacifier. Pacifier clips are really helpful, and as a mom myself, I do not want to be washing a pacifier in the middle of a restaurant or when it falls on the ground, knowing that I can't offer it again to my child. So pacifier clips are a great way to keep things clean and healthy, but most pacifier clips have a substantial amount of weight to them. And so that's really going to be a problem. So those cute little stuffed animal clips, the ones that have the cute little beads, those are all going to be too heavy for our infant. The ones that we're going to use will be these little lightweight fabric clips, really thin, very lightweight. The reason why is because all infants are born slightly retrognathic, which means that their chin is going to be tucked back just a little bit. And that's normal. That is a part of human development that allows babies to be born. But as our infants develop, we want that jaw to come more forward and create more encouragement of that mandible growth. Now, the problem is if you have a lot of weight sitting on the chin and on the mandible from that pacifier clip, it's not going to encourage the chin to grow forward, and it will actually discourage that forward growth. So be very mindful about what we clip to the pacifier, making sure it's really lightweight. And something, those beads, they don't feel very heavy, but it's just any additional weight to it. So stick with the lightweight pacifier clips. Now, any conversation we have about pacifiers, we definitely follow up with how and when to wean. And this is really important. And this is the part as a mom myself that can be tricky. So we talk about weaning even before we start the use of a pacifier so that everybody in the family is on board. Now, the suckling reflex that we talked about, it's really going to start integrating around month 4 or 5. And this is a fantastic human evolutional trait that just gets me every time because this is around the time that infants will start to explore solids in the coming months. So keeping pacifiers past that suckling reflex integration is really when it's going to lead to problems. And those problems can be feeding challenges, changes in the airway and the development of the palate, increased ear infections because the fluid can't move how it needs to, and then those persistent infant reflexes that should have progressed past, but the infant still holds even as they grow into a child. So I always tell families the timeline of when we're going to start weaning is 4 to 6 months. Now, this does not have to be something that we just do overnight cold turkey. This can be a gentle weaning process, and that we're going to aim for absolutely no pacifier by 12 months. And that's because that's when the first tooth are starting to erupt, and anything beyond that is really going to have more impact on the oral anatomy than it did previously. So when we're developing a weaning plan, I always say, get on board with everybody that cares for that child. So parents, co-parents, grandparents can be a good one. Making sure the daycare providers are also on board that you know your child will no longer get a pacifier. The key is that as we start weaning around that month 4 to 6, you're going to start associating the pacifier only with sleep. And then once that infant falls asleep and the pacifier comes out, we do not pop it back in. We're not playing pacifier ping pong with our babies. Pacifier comes out, we're done with it for the moment. And then we're going to start replacing daytime use with the pacifier with something really fun. So a teething toy. I really like Chewy Tubies. I really like the Myo Munchie. These are great oral tools for the infant to play with to start activating their gag reflex, starting getting ready for chewing, and using that oral skill that they have, but in a more advanced, mature way. Now, I say let's wean by 10 months, knowing that if we have a few little bits left, we're completely done by month 12. And when you are actively in weaning, so when you have decided we are done, if everybody in the care plan, everybody that takes care of that child is on board, it should take about a week for an infant to progress through. It may be a hard week, and as a mom myself, I can understand that. But if everyone's working together, it should take about a week. If it's taking longer than that, then we really need to dive into the why. Did every caregiver stay consistent with the plan? Would be my first thing to look into. The second one is we need to look into how is that infant's oral motor development? And is there possibly a sensory or an airway issue that that infant really needs to stay with that pacifier to help them with? And they haven't learned to self-soothe, or they're having problems breathing, and that pacifier is really supporting that, then that's an infant that we will stop weaning on and dive into that issue so that we can go deep into the root reason of what's going on. Now, the long-term impact of not weaning. This is when we start to see those Instagram posts of the dentist showing how a pacifier affects your teeth. No infant is going to have that problem because we're going to stop it. We're going to stop pacifier use before they have teeth. But yes, if a child uses the wrong pacifier or even the right pacifier for too long, then this is when we're really going to see changes in their occlusion, which is how their teeth come together. We're going to see an open bite where their front teeth don't touch because the pacifier has stayed there so long. We are going to see a more narrow airway. Using the wrong pacifier can really help decrease that oral muscle tone, which is not what we want. It can also help that baby learn how to have a tongue thrust when it's not what we want. And again, we've already talked about the importance of these infant reflexes, and that retaining those infant reflexes too long will inhibit that child as they grow. So my final thoughts and takeaways that I hope you take with this presentation is that it is okay to use a pacifier. That pacifiers can be wonderful tools when used correctly, but we need to choose the correct pacifier, and we want it to be an active use pacifier, and that we only really truly want to use it for the first 4 months. That we're going to then start a gentle weaning program around that 4 to 6 months and be done with it by a year. And then we're always going to cue in. If there's feeding issues or suckling issues that persist, then this is where we're going to start diving in. Does this infant need more information? Is it a possible oral functional eval that this patient needs? If you're ready for the next steps, follow me on Instagram. It's so much fun to see everybody and interact. The handle for Latched Beginnings is @Latched_Beginnings. If you feel that your child may have a tongue tie, that there's something more going on, schedule an office visit. And I'd love to talk to you. You can find a lot of resources like a checklist, different usage at our website. I always tell patients, if something feels off, trust that parent intuition and dive into it. Let's get an answer for you. Thanks, everybody. It's been a pleasure to spend this time with you. I hope that this was helpful. Let me know. I'd love to hear your thoughts. Sharing education, both as a dentist, but also as a mom, and making sure that other families have the correct information and not just something that's come off of the internet science that we like to say, or the internet moms. This is something that is truly a passion for mine, and I appreciate you being here. I hope you all have a really great day snuggling your sweet little babies. Bye.